comes to the hospital upgrade, there are a few elements to be considered, especially the facility, technology, and human resources. These are the main key factors which we should be able to consider in the upgrade. Mainly, the technological upgrade is a key element in the hospital function, and any hospital for that nature has to keep on upgrade themselves at least every 4 to 5, 6 years time to be in par with the competitors or with the industry or regional players. So when it comes to the hospital investment is concerned, the return on investment is around 7 to 8 years for a new hospital. But the technology changes every 3 to 4, 5 years time, and most of the hospitals are compelled to change their technology and go for the new upgrade in par with others. So it's a little bit of a burden for the investor, but it's an unavoidable situation. But in Sri Lankan context, if you take, most of the hospitals are in par with the technological levels and standards in the region. But I personally believe there is room for us to improve in par with the regional players, especially compared to India, Singapore, and Malaysia. There is a room for us to improve. But the bottleneck when it comes to an upgrade is the finance, because we have to make sure as a hospital administrators, when we are recommending for an upgrade or we are going for a technological new setup, something to be obtained, we have to make sure the financial paybacks are in par. But unfortunately, in the recent past, the spending power of the customer is also coming down. And I strongly believe the main competitor for the private healthcare sector in Sri Lanka is the government healthcare sector, because government is spending a lot on technology in the government hospitals and with the good human resources. But of course, with the average facility, that's a better place for a patient. But people they like to come to the private hospital for a better facility. So we are compelled to keep our standards in par with the government. But the paying capacity is an issue here. So it's very crucial decision a hospital administrator has to take it against the return on investment. But I strongly feel Sri Lanka is in the right path, and most of the hospitals are currently in par with the technology which is available outside our country. Then coming to the facility, because ideal hospital facility should be around 800 square feet per patient, and that's a lean structure, we can look at it, so that better technology can be invested, whereas the cost of a civil structure could be maintained at an optimal level. But a medium hospital would, I can say, around 1,000 square feet per patient. So, for example, if we take a 100-bedded hospital, then of course we can talk about 100,000 square feet built area. Whereas in a lean structure, if you want to reduce the cost of the civil structure, then of course we can go for it. But if it is a luxury, then we can always go for 1,200 to 1,300 square feet. But as an administrator, looking at the financial constraints, probably the investors will have it, I recommend a hospital to be built in line with around 800 to 1,000 square feet per patient, so that money can be saved and can be invested in technology. And the other point which I would like to stress is a human resource, because again, when it comes to the hospital human resources, it's not only doctors, the nurses, consultants, and the technicians, paramedical staff. So there are from white collar to the non-white collar staff are there in the hospital, and it's a very key element that they also should keep their knowledge in par with the standards of what is happening around the world. But that is something which I would like to say, not the consultants and doctors, but some of the staff are still in the earlier stages. I see because of the lack of training facilities available in the country. So I strongly believe we should invest on the human resources to train themselves in par with the technological and also the facility upgrades. So as an administrator, my recommendation is when we are looking at an upgrade, there are a few things to be focused. One is the return on investment, and the second thing is what exactly the technology you are selecting to choose to upgrade the facility. And then third, what is your position and what is the position on the human resources, what you are looking at it to operate and manage the facility. And moreover, the hospital, because happy people only go to the hotel. The sick and sad and anxious people come to the hospital. I believe hospital should be a pleasant place for people to come, because when they are anxious and sad and when their loved ones are sick, they would like to go to a place, at least it gives some sort of a soothing along with the medical care. That is the reason private hospitals play a crucial role in treating the patient, because we need to treat the patient and also we need to treat and look after the patients near and dear. So a good, clean, lit up facility is very crucial, because gone are the days in Sri Lanka, the private healthcare sector had started with medical centers and nursing homes, and now we have beautiful, internationally famous facilities which have gone through several accreditations like Joint Commission accreditations and Australian accreditations and ISO. So we are in par with the international standards. So, but I would like to see many more hospitals embrace this facility upgrade, so that it will become a very pleasing and pleasant environment along with the technology and the good human resources.